everyone, today I'm going to go over differentiating between different peripheral nervous system pathologies in the objective exam. To do this, I'll be referencing my score builders flashcards that I used when I was studying for the physical therapy licensing exam. I held on to them because they're a great resource. Okay, so let's begin with the pathologies associated with intact sensation. The first thing to test for is strength, as the pathologies will present differently in regards to muscle weakness. You should also note the presence of atrophy of the skeletal musculature. Next, test deep tendon reflexes. Believe it or not, these two tests combined with a solid subjective interview should tell you all you need to know. Remember, we're assuming that sensation is intact for these patients. You should test several different aspects of sensation to ensure that the patient's sensation is in fact intact. So maybe my next video will discuss screening sensation. Anyway, in the presence of intact sensation, if the patient exhibits signs of motor weakness and atrophy with decreased DTRs, you should strongly suspect anterior horn cell pathology such as ALS or polio. If the patient exhibits muscle fatigue more so than muscle weakness with normal DTRs, you should suspect neuromuscular junction pathology such as myasthenia gravis. The third pathology is muscular pathology such as muscular dystrophy. With this diagnosis, the patient will exhibit muscle weakness and DTRs can be normal or decreased. Other signs associated with muscular dystrophy are Gower sign, which can be seen here. So note how the child uses his upper body to assist with standing from the floor. Children with muscular dystrophy may also present with pseudo-hypertrophy of the calves. Okay, so let's move on to peripheral nervous system pathology with sensory loss. With any pathology of the peripheral nervous system, with sensory loss, fasciculations are possible, so that's not really going to help us diagnose or differentiate between diagnoses in this category. Just know that fasciculations are likely. So the first thing we're going to test for is sensory deficits in a dermatomal pattern or along the nerve root versus a stocking glove distribution of sensory impairment. So the stocking glove distribution should immediately raise your suspicion of peripheral neuropathy, or especially diabetic peripheral neuropathy. Should you choose to further pursue your diagnosis, motor weakness and atrophy greater distally than proximally and decreased DTRs should strengthen your suspicion of peripheral neuropathy. To differentiate between peripheral nerve pathology as from trauma from spinal root and spinal nerve pathology as from disc herniation, DTRs and muscle strength testing should be performed. In the case of spinal root and spinal nerve pathology, muscle weakness would follow a pattern associated with those muscles innervated by the nerve root, and decreased DTRs should be expected. In peripheral pathology, motor weakness would be associated with the specific nerve that was injured. So think C7 disc herniation versus radial nerve trauma. So I didn't include a summary in today's discussion since there's already graphics as part of this presentation. If you like what you see, please check out my other videos and like and subscribe to support this channel. Thank you.